Hello and welcome to the Cervical and Thoracic Spine recorded lectures. This first lecture is really meant to be an introduction to the cervical and thoracic spine. We'll discuss lumbar spine later when we get to chapter 9. So let's get started. The vertebral column provides a flexible but supportive column for the trunk of the body and the head, and it transmits the weight of the trunk and the upper body down to our lower limbs. Openings in each vertebrae line up to create a tube-like spinal canal, which you already knew. The spinal canal begins at the base of the skull, which you can kind of see up here, the base of the skull, and extends distally all the way to the sacrum. This canal contains the spinal cord and is filled with cerebrospinal fluid. The spinal cord actually begins with the medulla oblongata in the brain. It passes through the large hole in the base of your skull called the foramen magnum, and it continues through the first cervical vertebrae all the way down to the lower border of the first lumbar vertebrae. So you can see that illustrated here. At that point, it tapers off into something called the conus medullaris. In some people, the conus medullaris may extend as low as L2. Therefore, any type of lumbar puncture into the spinal canal usually occurs below that level at L3, L4. Intervertebral discs are found in between each vertebrae. We'll talk more about those later. They are cushion-like discs that are made of very tough fibrocartilaginous material, and they're tightly bound or attached to each vertebrae to provide stability for the spine. However, these cushion-like discs or intervertebral discs also allow for flexibility and movement within the vertebral column. So more to come on the intervertebral discs. Okay, the vertebral column is divided into 5 sections. The vertebrae within each section have distinctive characteristics, and we'll spend a lot of time comparing and contrasting those characteristics and looking at them on diagrams and our bones in lab. First, notice the difference between the child and the adult spine. You can see that here. The average adult has 7 cervical vertebrae and 12 thoracic vertebrae. And each of the 12 thoracic vertebrae are connected to a pair of ribs, which we'll study in the next unit. Dorsal spine is the old term for the thoracic spine, but it isn't a very accurate term since all of the spine is located in the dorsal aspect of the body. So if you hear the term dorsal spine, they're referring to thoracic spine, but again, it's an old term that we typically don't use anymore. The largest of the vertebrae are the 5 lumbar vertebrae, which you see here in blue. These are the strongest vertebrae in the vertebral column because the load of body weight increases towards the inferior end of the spinal column. And think about it, again, that trunk is really transferring all of the weight of the body into the lower limbs. For this reason, the cartilaginous discs between the inferior lumbar vertebrae are common sites of injury and pathology. And probably all of us know someone who's had a back injury or a herniated disc at some point. It's pretty common. The sacrum and coccyx develop as multiple separate bones and then fuse into 2 distinct bones. And that again explains the difference between the child and the adult spinal column. So look at, in a child, the sacrum is 5 different segments, and the coccyx is 3 to 5 different segments. Again, as we age, those segments fuse into one single sacrum and one single coccyx, and that fusion occurs sometime after the age of 18. The normal spine has a series of curves, and we use the terms concave and convex to describe the direction of the curvature. concave meaning a depressed surface, like a cave, and convex meaning an outward or elevated surface. However, the curves are described as opposite depending on whether you are describing them from the front or the anterior surface or the back or the posterior surface. So in other words, what appears to be a convex surface posteriorly is actually a concave surface anteriorly. Bontrager will always describe the curves as though the patient were being evaluated from the posterior. So for thoracic spine, we're always going to describe it as convex. Okay? Therefore, the cervical and lumbar regions have concave curvatures and are described as lordotic. The thoracic and sacral regions have convex curvatures. Soon after birth, the thoracic and sacral curves begin to develop. These two curvatures are therefore called the primary curves. Okay, so let's say that again. The thoracic and sacral are primary curvatures. They develop shortly after birth. Okay, as children begin to raise their head and sit up, the first compensatory or secondary concave curve forms in the cervical region. So notice the cervical curvature here. As the child learns to hold their head up, that compensatory curvature develops. Typically, children are holding their head up as early as 6 weeks. The second compensatory concave curve, the lumbar curvature, develops when children learn to walk. And that is anywhere from 10 months to 15, 16, 17 months of age. Both of the inferior curves, the lumbar and the sacral, are usually more pronounced in women than in men. And these curves are normal and help to increase the strength of the vertebral column and help maintain balance when we're standing in an upright position. However, when the curves become exaggerated or abnormal, we use certain terms to describe them. So for example, the term lordosis refers to an abnormal anterior concavity of the lumbar spine. So it is anteriorly concave more than normal. Kyphosis is an abnormal condition characterized by increased convexity of the thoracic spine. So again, kind of more of a convex curvature than normal. Kyphosis is noticed for us often when we're doing chest x-rays. So think about a lateral chest x-ray on an elderly patient. You'll notice kyphosis. It's not that uncommon. Kyphosis can be caused by conditions such as osteoporosis, where there's a loss of bone density in the vertebrae. If the spine is viewed from the front or the back, the vertebral column is usually straight, right? We know that. But occasionally, a slight lateral curvature occurs in the upper thoracic region of a healthy adult. Okay? This curvature usually is associated with the dominant extremity. So if you're right-handed, you might get a slight curvature towards the right, if you're left-handed, towards the left. So the middle drawing here could indicate this person is right-handed with a normal convex curvature of the T-spine to the right. However, an abnormal or exaggerated lateral curvature of the spine is called scoliosis. And this is a serious problem that occurs when a pronounced S-shape lateral curvature exists. And you can see that here. So that is an abnormal lateral curvature. It can cause severe deformity of the entire thorax. The effect of scoliosis is more obvious if it occurs in the lower vertebral column, where it may create a tilting of the pelvis, and that can have an effect on the lower limbs, even producing a limp or an uneven walk. Children are screened for scoliosis, maybe at school or at regular checkups with their doctor, and hopefully you'll have an opportunity to do a scoli series at clinicals. Severe cases of scoliosis require surgery and braces to straighten the spine, and we'll revisit scoliosis when we talk about spine pathology. Okay, we're going to conclude part 1 here. We're going to pick up part 2 with the characteristics of a typical vertebrae.